School nurses are perfectly placed to look after children with asthma and to monitor the condition.
Children spend a lot longer in the school environment than they do with us, and actually making sure that when conditions are deteriorating, this is picked up, flagged up, and children are sent to see their GP, but also is the ongoing support. And school nurses are our eyes and ears during the time when we're not seeing our children.
Schools are particularly important for identifying children who maybe have a diagnosis of asthma but it hasn't yet been made. So children who are struggling to go upstairs, struggling with exercises, I think those children need to be flagged up.
Because the medication comes out of an inhaler really, really quickly.
But those are the children that we need to see in primary care and secondary care, because a little bit of medication can transform their lives.
Your asthma shouldn't stop you from doing whatever you want to do either.
Working with schools myself, what I found is there's variable standards of practice.
To be quite honest with you, it wasn't something that was really widely talked about at school nurse. They were more interested in sexual health and things, mental health. But asthma wasn't really a big topic at school, when it probably should have been spoken out a lot more.
For example, at Gillespie School here, we've had an asthma register all the years that I've been head teacher here, and I am aware that not all schools do have registers. And to be honest, I think part of that is about ensuring that you're meeting statutory requirements. To me, it's an obvious thing, but it seems to work better if we have a better partnership with health services so that we're getting the right advice.
One day on the way to school, Harry became poorly, his chest was hurting and he was breathless. So when we came into school, we asked for his asthma pump that they keep at school every day, but unfortunately it was locked away and they couldn't find the key. So yeah, it took about 25 minutes for Harry to get his pump.
I think schools that don't have the right kind of training, the right kind of systems and support are at risk of not enabling their children who have asthma to be protected. It's as simple as that. If a child has an asthma attack and you don't know how to support them, and you don't have the procedures and you don't have the actual equipment that is needed in a school, then it could be life-threatening. It's as simple as that, but as serious as that.
In terms of inhalers in schools, the law changed in September 2014, so actually schools can purchase an emergency inhaler to have in school. It's really important that they do have a backup inhaler. In order to improve the current standard, CCGs need to think about employing somebody perhaps with a school nurse background or someone that's based within the school nurse team to manage long-term conditions, asthma being one of them. That would be the ideal.
What we have found at this school is that many parents need additional support in order to know how to actually support their children.
It would be great to have a little bit more support from school, not actually from the school staff, but from, say, a school nurse seeing Harry at school if and when needed.
So part of our toolkit is providing some advice to schools, support for teachers, administration in schools about making sure that we're giving the right support for kids with asthma.
I think the toolkit that's being provided for schools is definitely going to raise standards of care, because what it's doing is it's ensuring that schools are up to date with national legislation and policy, what we are required to do, but it's also giving us a whole host of strategies so that we can actually support families and directly support and teach children how to look after and care themselves, because it is important that we have these practices in our schools, and the bottom line is that our children know how to take care of themselves.
The Asthma Toolkit is an amazing development, so everything that schools will need is there. So the policy is there for them to draw on, so they don't have to develop a new one. Any paperwork that they need to implement an asthma-friendly school procedure is there. It's all in the toolkit.